All right, hey, it's Joel from the Hack Life, and I am here with Dr. Michael Twyman, the biohacking cardiologist from St. Louis, Missouri. Is that correct?
That is correct. Thank you for
And did I
having me.
say did I say your name right? Twyman?
Twyman, yeah.
Okay.
English.
I can resonate. I have a
Yeah,
Welsh last name, so
yeah.
it always gets butchered though. So, welcome to the show, man. I'm really I'm really pumped to have you on. I've been going through your page and just checking out all the stuff that you're up to, and you're not the normal cardiologist. You're doing a lot of cutting edge things, and yeah, I'm just really excited to dig in. And I'm sure there's just so many people, I'm sure have a lot of questions when it comes to heart attacks, heart
Mhm.
disease, all of that, and we're gonna take care of that today. And then I think there's a lot of other cool stuff that you're up to that people don't know about, and so I want to get into that. Um, Having said all that, though, can let's just start it off. Like, tell me the day you realized you wanted to be a cardiologist. Like, that's a very specific field, I imagine.
Well, I always knew I wanted to be a physician since about the fourth grade. Didn't know I necessarily wanted to be a cardiologist probably till, you know, third year of medical school. In medical school, they send you through all the different rotations. So you get experience with, surgery, OBGYN, psychiatry. And for the longest time, I actually thought I was going to be a pediatrician. But eventually, the pediatric cardiology it was just too hard for me to see the kids struggling. So I figured
Oh
I'll take
wow.
care of the adults, the people who make some bad lifestyle choices. I'll try to put them back together. And cardiology was just fascinating. The physiology of how the heart works. There's some imaging of the heart. There's rounding in the hospital. There's doing procedures. There's talking to patients in the office. So no day was ever the same. So I just thought it was a very fascinating career to go into.
Wow. Is there is there anything now that and how long have you been doing it?
I finished the cardiology fellowship in 2012, but I've been a physician since 2002.
So since 2002, and kind of everything that you've learned and you've amassed over the years. And is there anything that like surprises you now, or is there anything that's like surprised you of like kind of what you've learned throughout all this time and what's changed?
It's a great question. I did 10 years of training post college, and it's great for when you're really sick to have those acute skills to put people back together. But now that I've kind of you know, I don't know, I'm not going to even consider myself middle life. I'm going to say I'm maybe quarter life. I'm try to beat a grandmother's record of 106 years old. So.
Oh, that's
Um,
good.
so I kind of really gone into like the longevity medicine type of kind of modalities in the past couple of years. And it's really realizing that reconnecting with nature and using biohacking or health optimization. Um, it's really the basics, how you sleep, how you move, how you feed the body, how you deal with stress. Those are so much more important than whatever pills you're going to pop in your body.
Okay, so you are known as the biohacking cardiologist. Well, what does
Correct.
that mean, and like what does that mean, and how are you biohacking cardiology?
So I kind of self proclaimed myself that in 2017. My wife wanted to go to Bhutan, where the happiest people in the world exist. Bhutan's a country about the size of Indiana. It's sandwiched between China and India, and it's about a 14-hour flight from St. Louis. So I've tried to read up a little bit about how to not die from the jet lag flying 14 hours. So knew about melatonin, of course, but I stumbled upon some article from Asprey talking about blue blocking glasses and bought the pair. Did not understand the science at that point. Just wore them on the plane and essentially looked like the Unabomber on the plane. I had the hoodie on, the headband, and the glasses, and slept decently once I got over to the other side. And the jet lag was maybe, in my estimation, like a third of what I thought it should have been. And so I was like, man, there's something to this light thing. So after the trip, came back and really went deep down the rabbit hole of how light affects your biology, and basically been doing that for the past 3 years. And so now everybody in St. Louis tech kind of calls me the biohacking cardiologist because I'm always talking about the glasses and the photobiomodulation, the red light boxes and stuff. So
Okay, so you're a cardiologist though. So again, I mean, everyone like big deal. Blue blocking glasses. We know about blue blocking glasses and how they're good for you, but are you seeing any trends with light and blue light or any light with with the heart?
for sure. I mean, especially during this pandemic, people are, drawn inside more. They're communicating, working via Zoom. I've been on 4 hours of Zoom calls prior to this today. And,
Boy.
if I wasn't, adjusting my circadian rhythms, protecting my eyes, I would be devastated with, 8 hours a day of computer time. So, you're 2,000 people a day in the US die from cardiovascular disease. So how you deal up with your daily habits is going to decide if you're going to be one of those people sooner than later. So I'm very strict and teach myself and patients about, how do you really adjust your circadian rhythm every day? And it starts with the light that enters your eyes.
And so by just adjusting the light though that we're getting into our eyes and our bodies and however we're getting this light, you're seeing though a correlation with that and just I guess the heart and then or is it just overall health which in turn affects the heart?
It's probably the basis is really more on, getting people high quality sleep.
Mm.
If I wasn't a cardiologist, I probably would be probably going to sleep medicine now, just because I realized the importance of that time for the body to do autophagy, apoptosis, kind of repair the mitochondria at night. So, people, always want to focus on exercise and, nutrition, but if you don't get those things, I guess you should say that, you can get those things right, but if you don't sleep well, you're not going to consolidate the gains from, putting in the healthy fuels and doing the hard work in the gym or outside. So sleep is the key. And, the things that really set, the time for sleep is, again, the light environment that you've been exposing yourself throughout the day, especially avoiding the artificial light at nighttime.
Yeah. Yeah. So in your practice and you have a private practice, correct?
Correct. Yeah. About a year ago, I launched my own practice.
What was the impetus for that? Where did you feel like some of the things I know just from talking with other doctors, they feel kind of stymied and held back in some of the things they can say in a hospital setting. Like you have all this knowledge in the biohacking or just alternative health world, but a lot of them feel like, well, I can't say that because I'm not allowed to per whatever the guidelines are that I'm. Was that some of the reasons, or what led you to that?
It wasn't so much that I couldn't say things, it was just more that the time constraints of some of those moments, I would really try to hammer upon people like, focus on your sleep, maybe use these glasses, but you're trying to do that in a 20-minute visit where
Yeah.
they wanted to talk about their blood pressure, their blood sugar, their cholesterol, which are all important things. But if they don't sleep well, all those other things don't matter nearly as much. And I was doing a lot of hospital medicine at that point and, taking care of people with acute heart attacks and heart failure and, really sick in the ICU. And, I still, appreciate the ability to do that, take care of really sick people, but I kind of wanted to not take care of just people who are Humpty Dumptys and you're trying to pick them back up and keep putting them back up. I wanted to try to prevent people from ever getting there in the first place. And that really required me to kind of rethink about like how I was going to, provide this medicine. And the best course ultimately was to kind of go out on my own and be able to focus on, reaching out on social media to grab the people who are interested in the lifestyle component of medicine. And, it may be a little bit bizarre to say like, well, why would I need to see a cardiologist? I don't have a heart problem. Well, the goal is you see me so you don't have a heart problem. And if you do one, I can kind of translate, okay, what is the general cardiologist going to be telling you what you need to do? And okay, do this during the acute problem, but long term, you're going to do this so you don't end up there again.
Do you find that a lot? Just something that you kind of resonated with what I said, what you said. Sorry. And that is like I do a lot of biohacking, alternative health. I do a lot of just things to try to keep my engine and my body healthy. I would, and I have health insurance, but I would never go to a cardiologist just because well, for me, honestly, a lot of the stuff that I think of Western MDs, I just don't trust them. I think a lot of the stuff they're spitting is 30 years old, and we can talk about that. So I wouldn't even go to one because I would assume they're going to give me some procedure or something that's just archaic and is old. So I'm not even going to go to it. But so do you get people like me? Like I think I'm healthy, 38 years old. I work out, I do stuff, and then they show up with you and you do some kind of exam. You're like, hey, you could be better here.
For sure. And those are the people actually I want to get my hands on is, the people who are, you know, 30 to 55 years old. I mean, I work with all age groups, but that's kind of the sweet spot is the people who think they're doing everything right. You test, don't guess, look, actually at the arteries non-invasively and say, hey, you have plaque in your arteries. You don't know, what exactly is putting that in there at this point. If you work with me, we can try to uncover one of these 400 things that likely puts that plaque in there, shut it off so that you don't go on to have that first heart attack. And, just looking at somebody from the outside, they can look super fit. I mean, Bob Harper, dropped dead essentially in the gym. He had high lipoprotein A, which 20% of the population has. It's a very inexpensive test to get, but if you don't get that test, you don't know if you're at high risk.
Great point. And then, okay, so here's a question because you just mentioned lipoprotein A, right? And I know there's companies out there like Wellness FX, and they can kind of like do like each lipoprotein and
Mhm.
various sorts, so you can kind of get a better idea of like LDL and HDL. Now, there's a couple books I've recently read, and one of them was actually Paul Saladino's The Carnivore Code, which I think you're familiar with, right?
Correct. I
Carnivore
haven't read the
diet.
book, but I know of it.
You know, yeah. So he talks. I think he's walking around with like a cholesterol of like 500, and he says no big deal. I'm not worried about it because his HDL levels are in line, and I think LDL in general has gotten a really bad rap, right?
Well, I mean, cholesterol is the substance that, every cell in your body needs. So cholesterol sometimes gets called the boogeyman that, it's in you because it's going to give you a heart attack. And, without cholesterol, you're dead. Um, so it's not necessarily the cholesterol that's the problem. It's the lipoproteins that transport the cholesterol around. And the lipoproteins are like little cars. They fill up full of triglycerides and cholesterol. When your body has more particles than your body needs, there's just a risk that they're going to drop off the cholesterol and it's going to get stuck in your arteries. But it's my mindset, and many of the people I read, it's mostly about inflammation. If your immune system's always turned on, taking care of a chronic infection, or you have a really poor standard American diet, and your body's inflamed, well, then the cholesterol is getting damaged because the cholesterol is kind of a repair mechanism. Now that damaged cholesterol is what's actually getting stuck into your arteries. But back to his point, I was on a podcast previously and somebody had cholesterols like that. I said, well, again, it's test no guess. I don't look at just one number and say, oh my God, you're so high risk. Why don't we non-invasively look at your arteries? And that CT coronary calcium score test, not a perfect test, but if your CT coronary calcium score is zero, indicates you're not putting any hard plaque in your arteries that we know of. Maybe that high cholesterol isn't a problem for you. But if somebody came to you and said, I want to be on the carnivore diet, and they had a calcium score of 400, I'd be like, you're pretty high risk. There's not data that the carnivore diet long term is going to be necessarily healthy for you. You just have to be more careful.
How much and how much do you think genes play a role in this? I know, and another big a big gene that gets tossed around is ApoE4. If you have this gene, you could be susceptible to, or maybe you being on a keto diet or some kind of high fat diet may not be the best for you. Do you do a lot of that in your clinic, or does that come into play?
For sure. And, ApoE is a complex kind of topic. But from a cardiovascular standpoint, there's an ApoE2, a 3, and a 4. You get one copy from your mom, one copy from your dad. Normal's a 3 and a 3. But if you have a 3 and a 4, you have an increased risk of cardiovascular disease. If you have a 4 and a 4, you definitely have an increased risk. And it essentially will increase your ability to hold on to cholesterol. You just tend to have higher levels of cholesterol, even if you're exercising and eating healthy diets. Um, you tend not to respond well to pharmaceuticals at high doses, particularly the statins. You're at higher risk of metabolic diseases, prediabetes, diabetes, and Alzheimer's, which is probably also was probably diabetes type 3 of the brain, just inflammation in the brain. So, evolutionary ApoE4 was beneficial probably for some like parasites and some other benefits,
Mm.
which aren't necessarily as important in modern day. But um, but I routinely will check ApoE in patients because I know we're gonna have a discussion a little bit about statins later. Is that if if patients have an ApoE4, I'm generally not going to recommend them the highest dose of statins if they're a good candidate for a statin. Um, so, but back to your original question about genetics, how important is it? Probably maybe 10% of diseases, chronic diseases, are truly baked into your genes, and there's not much you can be able to do about it. 80-90% of it's going to be your epigenetics. It's what you're doing in your local environment that turns those genes on or off. So I'm a big proponent for it, to really focus on your mitochondria, because that mitochondria genotype is much more important. How does those little things inside your cells making energy, how do they work? And if you can get those things making energy, you can reverse a lot of chronic diseases.
That's so cool that you said that. I'm really happy you did. And I know a lot of people I just talked to in passing, there's still that belief that, oh, well, it's my genetics. That's why I feel this way. That's why I have arthritis. That's why. And it's like genetics, like you said, I think I've heard one functional doctor say it's what loads the gun, but
Mhm.
epigenetics is what pulls the trigger, right? So, like your environment, what you put in your body, the input, what are you getting, the light, right? Which you know all about.
Right.
Those are like some of the key things. Um, So I'm really, really happy that, yeah, you said that. Um, when it you had said earlier in the interview, you said, yeah, that's like one of 400 things that we'd have to
Right.
like look at, right? To like in terms of preventing heart disease, right? In your opinion though, is there any like what are some like big ideas when it comes to heart disease as far as prevention? Are there like some really like big central themes that people should be looking at or thinking about if they're trying to prevent this plaque building up in their arteries?
It's a great question, and that's obviously what my main focus is at my day job, is getting people finding out where they are in that spectrum. Cardiovascular disease is extremely common, but it doesn't mean it has to be the end of you. But the first thing is, I learned this from Dr. Khan. Test, don't guess. You can't just look at somebody's blood pressure, blood sugar, cholesterol. They smoke, and if they're overweight, and say you're good or not good. That's just not enough information. And using something like the Framingham risk score, that was good when that was the only data that was available. But in this day and age, it's somewhat antiquated. You're trying to do population, like, okay, if you have these numbers, you're likely high risk. Why don't we do an N of one and look at you? Are you high risk? And there's great non-invasive tests that will look at it. So, I kind of do three main tests in my office to take a look at your arteries. The one that would look at, have you put any plaque in your arteries, is called the CT coronary calcium score. It's about $100 X-ray of your heart arteries, looking for calcium in the walls of the artery. Calcium is supposed to be in your bones and teeth. If it's building up in your arteries, that indicates that plaque is building up in your arteries. Your score should be zero, but 6 out of 10 people who do that test are going to have a positive score. A score over 400 is high risk, over 1,000 is very high risk. You're probably going to end up, definitely on aggressive medication, but potentially those are the people that are going to need stents, bypass surgery. Um, then the other test I'm doing in the office is called a carotid intimomedial thickness scanner, CIMT for short. But it's an ultrasound of your neck artery. It's not necessarily looking for the flow in the artery. That's what it is, like cardiac duplex is. But this is looking at the wall thickness. If your arteries are thicker than they should be, your biologic age and vascular age may be mismatched. So I'm currently 44 years old. My arteries were like 39 years old when I scanned them, but I had some guy the other day. He was 61. His arteries were like 42. I was like, good job.
Wow.
You're doing what you're supposed to do. But you'll see that thickness improve if the inflammation in the walls of your arteries improving. So if your arteries are younger than you are, then whatever you're doing is working for you. And then the third test I will recommend to patients doing is a test that measures your nitric oxide, essentially, how much can your arteries dilate. Endothelial dysfunction is the first marker of cardiovascular disease. So your endothelium is the inner lining of your blood vessels. It's one cell thick. If you laid out all your endothelium, it's about the surface area of 6 tennis courts. But if the endothelium gets
Wow.
damaged, then things start kind of leaking between it. I really don't like the word leaky gut, but it's kind of like leaky artery. So if the
Mhm.
endothelium isn't working well, things don't work well. But the endopat test, non-invasively in 15 minutes, tells you essentially like with a stress test to your arm, blood vessels, how much nitric oxide can they release. And if you have healthy endothelium, you're much less likely to be putting plaque in your arteries. So first do a kind of a structural evaluation, what is going on in the arteries, and then do the biochemical. So I mean, I do a very advanced lipid panel, inflammatory markers, looking at some other genetic markers and some more novel risk factors like cardiovascular disease, and then kind of come to the point like, okay, this is what's most likely putting the plaque in your arteries. This is how you shut off the faucet, and this is how you kind of start repairing the damage.
Wow. So using those 3 tests as a guideline, that really gives you kind of a good, blueprint and kind of a good format for how you assess people. It's just a great it's like almost like it reminds me of like maybe like a mobility specialist or somebody who watches somebody move. They can say, "Okay, I use these diagnostics to kind of
Mm,
see what I need to change, what I need to strengthen, what's weak, what's short, what we need to lengthen and strengthen." You're doing the same thing for the heart.
right.
Yeah,
Looking
that's
at
awesome.
the blood vessels. Look at them directly.
That's amazing. Um, because and so you really can't. I was thinking when I was thinking of like main ideas. There's nothing that really because it's so bio individual. You really can't just say, "Hey, in general, do these 3 things," and you'll lessen your chance of heart disease because you do so many different diagnostics. And what I'm thinking about when I ask this question is I read Dr. Catherine Shanahan's book, Deep Nutrition. I'm not sure if I'm familiar with that one.
Mm,
She had just came out with another book actually recently too. And what she talks about are some big main ideas when it comes to health, and one of them being vegetable oils. Get that out of your diet. So canola oil, grapeseed oil, all that junk. Sugar. being another one, like eliminate all of that. I mean, obviously that can be difficult, right? And then she just talks about kind of coming back to these, bone broths and these like really just ancient kind of not ancient, oh yeah, ancient kind of like cooking, right? And she talks a lot about that as far as really reversing some of these. I think vegetable oil is being one of them, and sugar being like two major culprits when we think of heart disease. Do you kind of have that same understanding, or I mean, or is it or for you? Is it just a lot bigger than that because there's so many other metrics involved?
I would say it's actually probably even a little bit deeper, in that food is information from your environment, and so I don't focus so much on the nutrients per se. It's the carbohydrates, the fats, the proteins. They come into your system. They ultimately get broken down into hydrogen and electrons that get fed into your mitochondria for fuel. So people sometimes get hung up on like, well, I'm putting premium fuel into the engine. If you don't tune up the engine, it doesn't matter how good the fuel is going to be. So yes, I'm all into, eating clean foods, whole, real foods. If it's in the box or can, and it's man-made, that's just wrong information going into your system. Um, so yeah, my kind of big tenets on nutrition are mostly, time restricted eating, not starving yourself, but giving time for the liver and gut clocks. Literally, there's these clock genes that turn on and off depending on when the nutrients come in. So if you want to go for optimal, go for 12 hours or less. Ideally, probably 10 hours a day of where you're actually putting food into the system. Water all day as long as fine. As for the fats, saturated fat sometimes gets a really bad rep that, you eat something fatty, it's going into your arteries. It's not that simple, and it's actually not been proven it to be that way. But um, mostly the things I talk about for fats is, on the blood test, I do check the omega 6 to omega 3 ratio or the omega 3 index and see how well is your body absorbing omega 3s. DHA, one of the components of omega 3, is extremely important for brain health. But essentially, you can think of it as also like insulation. It's what transmits energy from your environment to your mitochondria. So if you have low DHA levels, it's like a half charged iPhone. It'll work for a while, but not nearly as well as you want it to. And then protein is, the key to keeping your muscle mass up. Your muscles are your metabolic engine. I learned this from my, colleague and friend, Dr. Gabrielle Lyon. She's, the expert in protein metabolism. So you need the resistance training to strengthen the muscle, but also the timing of the protein, 30 grams 3 times a day, get your leucine in to do muscle protein synthesis. So focus on those three things mostly, and then fine tune everything else based on the results of what the blood work shows. So yes, sugar is a problem for some people, but honestly, if they don't get their sleep right, they don't get their light right, you're going to be chasing yourself. They're still going to have high blood sugars, even if they're eating clean, low carbohydrate. Just getting too much blue light at night and not sleeping well can cause you to be pre-diabetic.
Whoa. Okay. Okay. Let's right there. Let's talk about light and why it's so important. Like you've just, I don't know if people caught that, but you talked a lot. You talked about a little bit about light, just in terms of circadian clocks and gene clocks, and how important that is for regulating, our sleep and our gut clocks as far as when we take in um, nutrition and stuff. And but so talk a little bit about why, and you mentioned it already about blue light, but what are some big ideas for you? And I've seen your Instagram page. You're very bullish on red light specifically. Why is that?
So, I mean, red light is something that balances out the artificial blue light that most people are getting exposed to. So, for the video, you can probably see my shirt's kind of red. I mean, I
Yeah,
always
you've
have a
got
kind of
red
red light.
light
I always have a red
glistening
light in the
off at
room.
you.
Yeah, I always have a red light in the room that kind of balances off the technology. But red light or photobiomodulation is how you use these panels, red and infrared, to essentially the easy way to think about it is it charges up your mitochondria without having to eat food. So it repairs muscle inflammation, damage. I got interested in it. How could you use this for cardiovascular benefits? Most of the data literally was out of Russia. So because of the Cold War, all that data was buried for a long time from the Western scientists, so it's only now kind of getting rediscovered. But there's data in Russia that they did not have the same medications and stents that we did in the 90s and stuff. So they were using IV lasers and topical lasers to treat patients with cardiovascular issues. Helping with blood pressure, helping with angina, chest pain. So I was just trying to get interested in like, well, how could I sort of bring that to my current patient population, or at least use it for prevention? Took a very fascinating 8-hour photobiomodulation course the other month, and they're talking about how you could use red light therapy to stimulate stem cells. And if you can stimulate your stem cells, well, then those are going to go to wherever there's damage. And there's
Mm,
a very small trial done in Israel with like 24 patients having heart attacks. Half of them got treated with light therapy right during the procedure. So they all the patients got stented, got all fixed up, but the people that got the light therapy on the day that the heart attack happened and a couple of days after, they essentially had half the size of heart attacks because uh,
wow.
the light essentially gave energy to the mitochondria in the heart that those mitochondria didn't allow those cells to die while there wasn't oxygen coming to the system. So right now, it's more still theoretical how exactly this is going to be played out in the cardiovascular world, but it plays out well since I've been thinking about this since 2017. Is how does light affect your biology? And so now I'm going deep down the rabbit hole of how photobiomodulation actually works.
I saw a post that you had on your Instagram, and you actually had it looked like an IV with light
Yeah.
going into it. Is that the specific light you're kind of talking about, or are you talking about just like panels of red light were on the people?
For both. So I mean, the one you're talking about, I did the IV blood irradiation with there's a device called the Weber endo laser. Um, and it's overkill for somebody who's healthy. It's not something that you need to go rush out and go do. But I have a friend here in St. Louis that has it for her patients, and she treats a lot of patients with cancers and autoimmune conditions and chronic infections, and it's very
Oh wow.
beneficial for those situations. But a lot of the
Would that
biohackers,
be what about like Lyme? Would that be another one?
correct. Yeah. I mean,
Wow.
even, they don't have indications for it, but I mean, in Germany, they're using it experimentally to treat COVID because if they use uh, the UV spectrum on the wavelengths, you can essentially inactivate certain viruses.
Wow.
So, uh, so it's very interesting for kind of chronic infections and other things. But some of the biohackers have just gone out there just to see what it's like. Um, but you definitely I've definitely had more energy for like probably 12 hours after doing it. It wears off after the next
Yeah.
day. But like I have one guy who's got an extremely weak heart, and about a third of your heart is mitochondria. So you know we got this guy on maximal medications, supplements. He's got a special, pacemaker defibrillator trying to make his heart work better, and things aren't still going well enough. So I said, well, why don't you go try this before you go consider getting a heart transplant? But the IV laser, that was probably the definitely the most invasive, most craziest biohack type thing I've probably done so far. Yeah.
Is that something you think you'll bring to your clinic at Apollo Cardiology? Is that something you in the future you're looking at into?
I've definitely looked at it. I honestly don't know if I'll have the actual patient population to support the IV component to it um, because now I'm sort of getting into the more longevity and preventative stuff. So
Yeah.
hopefully my patients aren't sick enough that they need the big gun IV laser, but I wouldn't hesitate to use it in the right population. So I'm more
Yeah.
focusing on kind of the panels. So I have a couple different panels in my office and in my house that I play around with. Got the Weber Endo laser. People make a watch that can shine it
Ah,
right into your radial artery and your ulnar artery. So sometimes if I'm on like a podcast or something like that, I'll run it on. So getting some beneficial light while you're sitting inside.
so it actually irradiates at the wrist.
Correct.
And
Yeah,
what's it
shine.
called? The Weber. I'll put it in the show
Yeah.
notes. What is this?
This is the Weber Spectra watch.
Okay. And so it's actually sending or irradiating at the wrist, and so you're getting that good kind of you red light, those nano waves into your body.
Correct. Yeah. It travels off the red blood cells are kind of like ferry boats. They soak up that light and then take it to where it's needed.
That's fantastic. One of the things you mentioned too, just right there, was you're talking about COVID. We've seen a lot of information saying that COVID it's attacking the endothelium, right? The endothelium cells, and that's why people are having heart attacks, I believe.
Yeah, I mean, it's it gains access through these receptors in the lungs, and patients who have high blood pressure and cardiovascular disease have upregulation of that receptor, so they're just more prone to catching it. Um, but I I'm definitely not an expert in COVID, and because of the way I set up my practice, it actually took me out of the hospital. So I've not been rounding in hospitals
Ah,
where the majority of these patients are going to be located. So most of mine is just reading a lot of primary sources and finding out ways to really boost people's metabolic flexibility, and so that they don't get the virus in the first place, or if they do, they're going to have much more of a mild case. So obviously, a big proponent of maximizing your vitamin D status the natural way. If you're popping a pill, your body's immune system is first programmed by the sunlight that hits the skin. So, if you have a artificially high vitamin D level because you've been popping a pill, but you still don't go outside, your immune system isn't going to work nearly as well as you expect it to. And that's the whole key is that, in like the 1918 uh, pandemic, it was mostly younger people dying because their immune systems were so overactive when they got the virus. That's kind of the cytokine storm story. So if you optimize your immune status by getting outside, literally skin in the game and boosting your vitamin D level to 60, 70 naturally, um, your T regulator cells have been programmed. You're less likely to take the virus on, or if you do, your immune system isn't going to overreact and kind of kill off your cells while it's taking care of the virus.
Yeah, love that. In terms of in terms of heart attacks, I kind of want to transition.
Sure.
Talked a lot about heart disease. Now moving into heart attacks, is there anything, any other big ideas that you think about, or is the onset of heart disease is what leads to like someone having a heart attack? Or heart attacks I think can be caused from stress and a lot of other things as well, right? So how do you, when you see like big global picture of heart attacks, what are just some, big ideas that you think about people should, in order to prevent, heart attacks?
Sure. First, I'd like to actually, teach people, what is a heart attack? How does it actually occur? Maybe even before, I fully did all my training, you think of your artery as like a pipe and it just fills full of sludge. And after, a while, it's 100% blocked like a sewer. And now that's the heart attack. And it's really not that way. It's more that heart disease. And when I speak of heart disease, it's more that atherosclerosis or damage to your arteries. It's the walls of the arteries are sick, and it may be many years before the plaque is going to be big enough that it obstructs the blood flow where the lumen is, where the blood is flowing. So majority of people have no symptoms until they have a heart attack, and most heart attacks are caused by blockages that are less than 50%. So you have no idea that you have plaque in your arteries in the first place unless you do a calcium score or some other type of test that looks at that. Um, and then, you know, you think that you're in the clear. But I should back up a little bit is that, one of the classic tests that people think that, oh, I'm probably good is, they've done a stress test. And there's, multiple different types of stress tests. They put you on just a plain treadmill and they run you until they tire you out and see if there's any EKG changes. And if there's not, they say, well, you're good to go. But an EKG only stress test is maybe 70% sensitive. It's going to miss 30% of people who still have severe blockages. You can add an imaging modality. You can do an ultrasound, an echocardiogram while people are exercising, or you can do a nuclear imaging to look at the perfusion of the heart. That increases the sensitivity to like the mid 80s. So you're not going to miss as many people. But by the time a stress test is positive, you generally have to have a 70% blockage of one of your arteries. You're pretty late to the game. And so
Wow.
so if you fail a stress test, great, the test picked up severe disease. Okay, this person needs to be aggressively treated. But somebody passes a stress test, you still have no idea what is their true risk. If they have really excellent exercise capacity, it's likely to be lower. If they rock out on the Bruce protocol 12, 15 minutes, okay, you have very good cardiovascular condition, but you can still have plaque. You got 60,000 miles of blood vessels. You know, there's some of these ultra marathoners and stuff like that. They get heart disease because they sometimes push themselves so hard, they never let their body recover. And that inflammation from the exercise ends up damaging the arteries, kind of the innocent bystanders. So just because you're completely fit does not mean that you're at low risk of heart disease. You still need to go taking a look at the arteries sometimes. And that's, non-invasively, of course.
Wow. Oh, that's awesome. Thanks for breaking that down. That was great.
Sure.
Um, what are so what are some what are some things that you do then? This is what your field is. You're a cardiologist, so you're seeing patients all the time and every day. So what are some big things that you're doing on a daily basis that you think about in just overall health and preventing all these heart disease, heart attacks, because those are like big. Heart disease is like one of those, the top four, I think, like killers in the US. What are some practices that you try to implement on a regular basis to for overall good health?
It's a great question, and I get that a lot from my patients. Like, "Well, what are you doing personally?" And I'm like, "Well, follow me on Instagram. You'll see I usually post, most of the stuff I'm doing, but um, usually to kind of say what a typical day in the life of a biohacking cardiologist would be is I'm up, by 5 a.m.
Whoa.
I don't, use artificial light in the morning if at all possible. Otherwise, I just have like a red LED bulb on to kind of keep your cortisol levels as low as possible until the sunlight comes out. Meditate in the morning first thing, and then usually work on the most important task that I need to work on that day. So if it's something marketing for the practice or I need to write something, I do that the first hour of the day. Usually I have breakfast 6:30, 7 o'clock in the morning, but sunrise right now in St. Louis is about 6:50 in the morning. So I'm always outside. I don't care how cold it is outside or how hot outside for the sunrise because that's that light of the day which resets your circadian rhythm, tells you, okay, like a GPS clock, this is the time of day, this is how you make your neurotransmitters, this is how you make your hormones, go. So do that, go to work, and then, you know, sometimes it's telemedicine based, sometimes it's, actually in the office based, and then typically work out more in the evenings than the morning times, and do, resistance training. Right now I'm playing around with the X3 bar, so doing some,
Yeah, I got one of those.
yeah, I've only injured myself twice with it, nothing too major. Yeah, side
How
note,
did you injure yourself?
yeah, that's a good side note. So one was, keep taking it off from a press and the band kind of snapped back and caught me in the forehead, gave me a nice little kind of bruise for a little while.
Yeah,
And then the other one was like, you know, you're looking at those bands and the one looks like a tree trunk. I mean, it's huge. And,
yeah,
it says, it's like, 600 pounds pressing, like, and I'm not that strong. I'm
yeah.
built more like a cyclist or something like that. But so I was like, well, let's see, can I even press this thing? And like, I was able to do like a couple. I'm like, that's crazy. And the next day, like, I couldn't move my left arm hardly. Like, I thought like I'd slept on funny, but I like got like bicep tendonitis, like horrendous. Like, I thought like, oh my God, like tore my bicep or something like that. So of course, being a
Red
biohacker,
light.
I like ton of red light and, curcumin and a bunch of other stuff I normally don't necessarily take, but lower the
Yeah,
inflammation and it got better in a couple of days. So went back to the X3. So X3, and now I recently got a, Peloton, you know, to do some hit training because the gyms around here, some of them are open, some aren't, but the ones that are open, they want you to wear a mask while exercising. Like, yeah, I'm not getting into the mask debate, but like if you're exercising and you're getting your heart rate to 180, 190, it's really, really hard to wear a mask and doing that. It's a challenge
yeah.
at best. It's probably dangerous at, at the minimum. So end up getting our own bike, but I was posting a little bit of like how you can biohack a Peloton bike. You can plug it into Ethernet, turn off the Wi-Fi, turn off the Bluetooth. The power pack. Put it far as away from the seat as possible, and then the magnetic fields, the RF fields are as low as possible. So.
Very cool, man. No, go ahead.
And say, that's the nutrition part of it. Yeah, I usually am in a 12-hour window. I usually try to get less. Um, I basically follow a paleo template for the past 7, 8 years. You know, I'm not perfect in eating by any means. But yeah, I focus more on, the mitochondria and, the timing than I necessarily do about the fuel sources sometimes. And then I'm very strict on sleep hygiene. I sleep like a rock star. I mean, I've had a Oura ring since I came out off Kickstarter.
Yeah.
I don't necessarily wear it all the time anymore because I already know how I can sleep. But so if I'm doing something different with my biohacking, don't want to see if it affects the deep sleep, I'll put the thing back on. But really focus on getting I'm usually in bed 9:30, 10 o'clock, and get 7 hours or more sleep a night. So I really focus on the recovery part of it because, like I said, you can beat yourself up all day long, but if you don't recover well, you're not going to have that longevity game. And great grandma Ola made it to 106, and so I got a lot of work to do to
Yeah,
beat her. So
yeah, you do. And she didn't have red lights, and she didn't have all these other cool hacks,
no,
right? So,
she didn't have any of that stuff. No, so
yeah. Um, when I want to actually ask you a real quick question just before we move further before I forget. But just what's your take on statins? Especially as a mitochondriac that you are, we know a lot now that that statins are. You always hear people say, well, if you're going to take statins, you better take CoQ10 because
CoQ10. Mhm.
CoQ10. Thank you, because we know that that's going to take away from your mitochondrial health. So, do you how do you like think about statins, and do you really, and then after that, what do you do to, is there other ways to that you can help patients without even taking statins?
Sure, and definitely there is. So stands are a tool, and if you're at, your arteries are on fire, you've just had a heart attack, somebody's just dropped 3 stents in you, or just had your chest cracked open and got 4 vessel bypass, you got to put the
Yikes.
fire out. So
Yeah.
you throw the kitchen sink at this person at this point, trying to cool things down so that you're preventing the second event. So statins are a tool in that instance. I mostly look at statins as something that lowers inflammation and stabilizes the plaque. So plaque is common. The goal is don't let that plaque rupture. I didn't mention it before, how heart attacks happens. The plaque is kind of like a pimple or an abscess on the artery. If it gets red hot and inflamed and pops, all that damaged cholesterol and other cellular debris spills out into the bloodstream and a clot forms. That's truly what the heart attack is. So the statins are trying to stabilize that inflammation. The statins, one of the main ways they work is lowering the cholesterol pool at the liver level. But unfortunately, it has other side effects where it is affecting the mitochondria in the muscles. It can, basically decrease the way energy is being made in the mitochondria. And so, if the mitochondria in the muscles aren't getting the energy they need, you get the myalgias, the muscle pains, or the exercise intolerance. So, especially athletes will notice if they're on statins, they're not as powerful or not as fast. So taking CoQ10 with that might mitigate some of it. There are different statin classes, so I tend to use one over the other because it's less likely to have the side effects. And we talked about earlier the ApoE. I routinely check that to see, okay, is this person even a good candidate? If they're an ApoE 3-4 or 4-4, there's many times I say like, I really don't think a statin is going to benefit you. You have a much higher risk that it's going to cause problems. So I individualize it to each patient. You know, Even the standard guidelines talk about uh, utilizing the CT calcium score sometimes as a tiebreaker because sometimes patients come in and they have concerns. I'm concerned like you know I've heard there's side effects of statins. I don't necessarily want to take it unless I'm high risk. Or
Yeah.
they say you know my dad, was on the statin for 20 years and, I don't necessarily want to take it. Okay, well, go get a calcium score test. If your score is 0, then you're low risk. So let's work through lifestyle supplements or something else then. But you come back and your calcium score is 1,000, I'm gonna be like, well, your risk of a heart attack is well over 10%. You may want to try to lower that. Statins are one of the tools that helps do that. But if people absolutely can't tolerate statins or, just choose not to take them, I'm not going to yell at them. It's their life. But I'll tell them, okay, these are some of the alternatives, supplement wise, or if you're going down the medication route, you can block the cholesterol production at the way that the gut reabsorbs it. You can use
Mm,
different things that block the cholesterol production at the liver other than statins. So there's ways to get at the cholesterol question if you truly need to lower the cholesterol.
that's fascinating. Um, are there any testimonials or any patients that like stand out in your mind that were like just big success stories? Anything that like jump out at you when someone who whatever had triple bypass or just somebody who's like had some cholesterol that was enormous or that was just looked like a train wreck and then after seeing you and doing some of the lifestyle things and following some protocols really reversed all that?
Yeah, I mean, there's multiple patients, but kind of the story is, that they come in, they've been taking standard of care things, and they think they're doing well. I get some tests, I find out that they're higher risk than they thought. Sometimes they end up needing, invasive procedures, and they get stented, or they get, one guy was like 48 years old. He had the highest calcium score test I had ever seen. His, like I said before, the calcium score should be 0. Over 400 is high risk, over 1,000 is very high risk. His was like near 6,000 and he was 48 years
Whoa.
old. I was like, there's something really bad going on. We took him, pretty much the next day to the cath lab, took pictures of his arteries, and every single of his arteries was horrendously blocked up.
Ooh.
And we couldn't fix it with stents. There wasn't a space, and he also had this huge aneurysm in one of his arteries. So we had to send him to bypass at age 48. you know, it's very potential, we saved that guy's life doing that study. So I have many of these patients, they come back, we're getting their arteries to get younger. And, my goal is that, we give them enough energy in their mitochondria so they can go out and do what they want to do with that energy.
Yeah. That's awesome. Um, anything is there anything, looking in the future right now that that concerns you in the health world or health aspects? Is there anything that you're looking forward thinking that you're thinking about?
I said probably the biggest thing that's still, I think under recognized is just, people's relationship to technology and how it's really affecting their health. Um, you know, One, it's awesome, we're connecting, I'm, in St. Louis, you're in California, and we're having this conversation, and this is gonna help other people. But the technology draws you inside too much.
Yeah.
It disconnects you from nature. Yes, connect with people over the internet, but people need to connect with people in person. They need to really, sample their biophotons and their energy and feel like they're part of a community. And I think technology sometimes, interrupts that. Um, and then there's also the aspects of the EMFs, the electromagnetic frequencies from it that, I sometimes tell people the simple way to think of it is that, EMFs, or just different radio stations that your body listens to. And you may not be able to see them, but your mitochondria do. And sometimes it acts like a radar jammer. Your mitochondria are supposed to be looking for certain radio frequencies. They don't see it. And so they don't make energy like you want them to. And it can cause a lot of inflammation and cause problems in the cells. So I would say, use your technology wisely, and but really try to kind of use nature to balance that out.
Yeah. Okay, that's great. Yeah, because I'm just thinking about like 5G and some of the things that are,
That's
you
it.
know.
Yeah. Yeah, 5G is yeah, I've done a podcast or 2 about, like, I'm definitely not a 5G expert, but,
Yeah,
the higher the Gs on your phone is, the higher the frequencies can, interact with your mitochondria. They essentially, dehydrate, your mitochondria. It's like putting meat in, a microwave. It, pulls out the water, and if you don't have water in your cells, they can't do what they're supposed to do.
yeah. Um, you know, one of the things that probably not a lot of people know about you. I mean, we know you're we know about your the cardiologist. We know about your biohacking and just the scientific background. But one of the things that I found fascinating about you is just you are you're like you're really like a constant learner and someone who just wants to take it to a higher level. And I know you've been to a lot of like conferences. What was that one conference we were just talking about on offline before we
It was either the Perfect Life Retreat or the Empire Business Summit. Yeah, it was a bunch of entrepreneurs, and
the
one
guy
of them
bit.
had some Navy SEALs. Yeah, Bedros
Yes, yeah,
Keuilian.
yeah,
Yeah.
yeah. What are some like over this time, and what's some of like the big ideas that you think had a big impact in your life in the last year?
Well, I mean, I've had somewhat of a entrepreneurial, spirit for many years, but I've been working in the system, the machine. And sometimes I, call it like unplugging from the matrix. Like, there's a different way to do this, but there's not people who've done it before you. So you literally have to reinvent the wheel sometimes. And you just have to get brave enough to say, like, I'm going to figure this out. And so I did
Yeah,
some business coaching with Bedros and some of those guys and went to these conferences. And you realize too that like nobody really has this figured out. They just, believe in themselves. They put, one foot in front of the other, and they make it happen.
yeah,
And so, just being around some, motivational, people is great, but you have to self motivate. And these guys kind of gave me those tools to figure out how to do that on my own, and that's been phenomenal for my career and personal self growth. And that's the thing is that I definitely learned a lot in medical school and my training, but like the past 3 years I've read and interact with people that I never would have, approached those topics before. And you really realize that, you're going to be a lifelong learner because those are the people that really kind of figured out, how do you do this, optimally? How do you, live gracefully? How do you live in a community? So it's just every day is an adventure. And, these people kind of help me put me on that right path.
yeah. I love that. I mean, you're taking like bold, decisive action, right?
Mhm.
Instead, I
Right.
mean, like you said, especially being an entrepreneur and doing things, and I know that feeling. It's like it can be scary. There's a lot of unknowns, and every day you just taking that step forward and just keep doing it because versus sitting on the sidelines and thinking about what you might do or could do and should do.
Oh, for
But
sure. I mean, I had the analysis paralysis for so many years, and people used to
yeah,
make fun of me, like, it was like I would be thinking about like the 18th domino, like, well, I got to fix this. I need a marketing person for this. Or like, you just need to do X, Y, Z first. Like, what is your first step today? And so, yeah, that's one big thing I learned from them. Is that imperfect action beats perfect action. Like, you're going to
ah,
mess up. Just
love
figure
that,
it out as you go. So, don't sit around. When you're really anxious with something, you probably need to be doing something about it, not thinking
love
about
that,
it at that point.
love that. Hey, I'm getting ready to go into the lightning round of questions with you,
All
but
right.
before I do that, is there anything that I didn't ask you that you wish I had asked you?
I think we hit upon the majors. How does heart disease happen? What is the circadian rhythms all about? How do you optimize your sleep? I think we hit upon it all today.
And just something I wanted to mention before we go to lightning round is that you something I didn't mention is that you were actually you starred in a movie on Netflix. It's called Unflame Me, right?
Correct. It didn't make it to Netflix. It's on Amazon Prime.
Okay.
Yeah, one of my patients had some autoimmune conditions, and she did not necessarily want to stay on the lifelong steroids and immune modulators, and she figured out that there's things you can do from a lifestyle nutrition standpoint and exercise, and I just kind of helped on her journey, and she reversed her autoimmune conditions and is doing well to this day. So she made a documentary about it, and it was actually, the funny side story is that, like, I think she asked me 3 times to do it, and I said no, because before I did that, like, there's no chance I would have been doing this podcast today. I did not like to be videoed. I did not like to
Yeah.
be, interviewed. And I said, "Fine, I'll do it." And she told me, like, she was just gonna put it on PBS. I'm like, "Well, nobody's gonna watch PBS, so who cares?" But then she puts it on Amazon Prime. I'm like, "Oh, some people are gonna see this now." So,
Yeah.
yeah.
That's huge, man, and, we appreciate you. I mean, just taking, like you said, your
Thank you.
bold action, and you're showing up in the world and in a very big, powerful way, and, like you said, all of us get to benefit from that, and so if you were holding that to just yourself or just St. Louis, then that's great. I mean, that's a great life. You did great, but man, the impact that you're gonna make just in the future is just, and what you're making right now is just huge, so
Thank
thank
you.
you. All right, let's jump into the lightning round of questions. Ready?
Let's do it.
If the old you could see the new you, what would the new you say?
I guess you should say, is it the old me, like, in the future old me, or my true old me is when I was younger self?
No, like your old you is like your younger self.
I would just tell myself, just believe in yourself more and just take the action sooner. Like, you will figure it out. You're going to fall down, just get back up and keep going. And then the people that you need to know will come into your life. The law of attraction, I don't quite understand how it works, but it is working.
I completely resonate with that. Yeah, I it blows my mind. Yeah, for me as well. Yeah, and how that law of reciprocity and law of attraction, it just seems to be circular, and just if you believe in it and you just do it and you put out good energy always seems to come back. So
Mhm.
I couldn't agree more. Um, what are some choices that you made in your life that made you who you are today?
It's a really deep question. It was more that, I just really kind of initially followed the path I was always supposed to go on. And it was, I had my head down for so long, like, okay, it's 4 years of high school, 4 years of college, 4 years of medical school. Okay, 3 years of internal medicine, 4 years in the Navy, 3 years in cardiology. And just had my head down the whole time. Like,
Yeah,
I'll be getting there. I'll be getting there at some point and I'll start living my life. But now I realize, like, oh no, that is your life. You have to live today. There is nothing promised in the future. So I've become very much more present oriented, and I think that's one of my kind of superpowers right now is that, like, I know nothing is given, and give back to the world. Help others, add value to them, and the world will take care of you.
that's so cool. What are some exciting projects that you're working on right now?
So I've been a little bit put on the back burner because of the way the pandemic shut down the world travel. Because I really do enjoy that traveling. I'm going. Supposed to go to Peru and Machu Picchu this year that got delayed, um, but I'm very interested in opening back up, having some health retreats. I've done one last year in Puerto Rico. I'll be doing one coming up in November down in Cancun, and it's
Ooh,
really just kind of showing patients and friends and colleagues, whoever wants to show up, how you actually have an optimal circadian day. I can do all the talking. I can kind of put the videos on stuff, but, like, sometimes it's just better to, like, put the person in the right environment and show them exactly how to do it. So I'm excited to kind of do more health retreats next year. Um, Definitely adding more photobiomodulation or laser therapy to my practice. I didn't go into it today, and I'm not gonna put it on because it makes you look kind of crazy. But this is the Weber laser helmet. Makes you look like Doc Brown from Back to the Future, but laser straight to the head, so radiating your brain for memory and performance improvements. And so I'm going to start playing with that, the next couple of months. So a lot of light therapy and showing people how to do things out in nature. That's kind of the goal.
now that A Weber, for people that can't, that are just listening to this and they're not using the video that we're going to record,
Yeah.
that thing that you put on top of your head, when I first saw it, it
Yeah.
looks to me like what people put on their head to like grow hair back. Now, that's not what you're doing. You're actually stimulating. It's for the brain specifically. And I know there's another like biohacking device called a Via Light that I
correct.
think does something somewhat similar. Is that would that be in the same
It's
kind of
correct. They're kind of in the same category. The V-Light people were first. The Weber one just came out November 2019. They use 810 nanometer near infrared because it can penetrate like 5 centimeters into the brain.
ooh,
Your brain needs a lot of energy, so this delivers energy to the mitochondria in the brain. And there's very interesting data on depression, anxiety, Alzheimer's, Parkinson's. But for people who have healthy brains, well, maybe it's going to help keep your brain healthier for longer term. So
what does something like that go for price wise? Do you know?
they're about 3 grand. So,
Okay.
yeah, right now you got to be kind of like a semi-professional biohacker if you want to have your
Yeah,
own. But I'm hoping to, play around with it a little bit enough that I know, some better protocols, and then I'll start offering it locally in my office. Patients can wear it, when they come in to see me and see how they like it. And ultimately they're hardcore, then maybe look at their own. But otherwise, I'll just have them in my office for people to play with.
that's so cool. And then Dr. Twyman, for the retreats that you're doing, is there a website or something that people can go to, or are you just kind of offering that on a more local level right now for the retreats?
It's not that it's not open to the general public. It was mostly to my current patients.
Yeah,
But my main website is drtwyman.com. Just drtwyman.com. Same handle, drtwyman on Instagram. So it's going to be in Cancun the week before Thanksgiving this year. I'm not expecting a lot of people to travel this year,
yeah,
but definitely next year we'll have one in Cancun again, probably because there's a lot of interesting healing possibilities down in Cancun. Um,
yeah.
kind of like the magnetic flux of the earth is better down there, so you can earth and ground a little bit more effectively there. But we'll do some also down in Puerto Rico.
Fantastic. Couple more lightning round questions.
Sure.
Who's someone in the biohacking or just wellness world that inspires you today that you follow?
One of the biggest mentors has been, Dr. Jack Cruz. I came upon his work a couple years ago because a friend was helped by him. My friend had multiple sclerosis and really wasn't getting well with a lot of the traditional treatments. And Dr. Cruz really showed him the way of how this light water magnetism really uh, repairs your mitochondria. And so, I've been deep down his pathways for the past couple of years and met him a couple times personally. And so he's one a big mentor. You know, Dr. Gabrielle Lyon, I've was put in contact with her from Beta um, and just learning more about how muscle protein synthesis works. I've always known exercise is important, but I didn't necessarily always focus on the strength training. But now that I got the X3 bar and not injuring myself with it, I'm going to really focus on the strength training in the next year. So,
On the X3 bar, I just want to give you a warning. Be careful also on the deadlift because one time I was eking out an extra rep and I let the bar go and it just slammed right in my
oh,
foot. So,
I'm sure.
kind of
Yeah.
like what you did with the chest press. Watch out for that. Okay,
Yes,
just
for
a little,
sure.
little tip. um, any book? I'm a big reader. Any books that you'd recommend that had just a lot of impact in your life? Maybe 1 to 3 books that really stood out for you.
So I'd say from like a medical book that's written for the kind of layperson. I mean, the circadian code is probably the best, starter book for people to understand how your circadian rhythm, your 24-hour cycle really works. When I read the book, I was like, it was so straightforward. I was like, it cannot be this simple. Like, just tell people to stop eating, after 5 o'clock at night or something like that, or 6 o'clock at night, and they'll lose weight and they'll sleep better, and their insulin system get better. I'm like, all right, well, I got to try it myself because you're a biohacker. You got to do it yourself, and my wife
Yeah.
does it too. And like, holy cow, your sleep does improve if you do this. And so I, taught many of patients about that book. Um, from a probably kind of an entrepreneur type book. Bedros' book, Man Up, was very good about, how do you actually lead people. Currently I have
Very
a team
cool.
of one other than myself, but, I have ideas of, how, when I scale this up, how things are going to go with that. But Man Up was a very good book about his entrepreneurial journey of not knowing what he was doing for quite a long time and, being an ineffective leader and how he transitioned to being a very effective leader to a, very successful fitness franchise, but also just how he became a better person. And it's not that the business side of it was the best part of it. Is just how he became a better man and better person for his family. So those are probably two best books I thought of. And then the other one is uh, probably Meditations by Marcus Aurelius, a super old book.
Ah,
It's 2,000 years old, but it's all about Stoic philosophy. So It's a very interesting book on how to truly live your life, live it, live it in the moment. You know, kind of start at the end, like you're going to die. Okay, what are you going to do until that day? So it's just a good way to kind of reframe your day.
Yeah, I love the Stoic philosophy, and I know Ryan Holiday has a great book that kind of sums up a lot of some of the
Mhm.
Stoic philosophy, which is great. But yeah, that's a great book too. Um, any rituals? We kind of talked about you kind of actually outlined it, but just kind of recap
Mhm.
any rituals or hacks or practices that you do on a regular basis. I know you kind of already outlined your day, but is there anything that like really that
Uh,
you really try to get in your day every day?
Pretty much without fail, I'm going to do the meditation. I mean, it's an extremely rare time that it's not. It used to be only if I was traveling, I'd sometimes miss a day or so. But meditation was probably the best thing I added to my life 3, 4 years ago, just because of the
What kind
way
of
it
meditation are you doing?
right now, it's just using the Insight Timer and just doing my own thing. Previously done like Headspace for 2 years, and I literally still have like Andy's voice buried in my head, like some of his
Yeah,
guided meditations. And I always recommend to the patients, like they always think that their mind has to be completely still, and it's like, no, no, it's just about like getting your mind to come back to the center. And Andy was pretty good about teaching me how to do that.
yeah,
Um, so meditation was very big. For a while, I'm not doing it as much, but measuring heart rate variability. So for people who are really hardcore athletes and stuff, you know, you want to know if your heart rate variability is kind of shot. If it is, you're probably overtraining. You need to kind of take a deload day or two. But there's some interesting data that heart rate variability may be one of the first metrics that gets messed up if you're coming down with a viral illness. So when COVID was really hitting, I was checking it routinely with the core sense and stuff, and uh, measuring daily HRV in the morning time. Um, Exercise is now back into the routine. Definitely during beginning days of COVID. You know, didn't put on like a COVID-15, but definitely got out of the usual habits, and now it's back on full speed ahead. Doing the you know regular exercise. So usually don't miss exercise, don't miss meditation, and try to do something good for society every day. So.
yeah. That's huge. Hey, really quick, before we wrap it up, as far as like light panels, or I know like Juve is a really popular brand, but is there any brand that I mean you seem well versed in modulation? Is there anything that you have kind of experimented with that you really like? I know you mentioned A Weber a lot.
Mm.
Yeah, any
So it's
brands that you?
it is one of the things where it's apples and oranges because you cannot necessarily compare each manufacturer's panels directly, and so for the most part, unless you're, having the gear at home to measure the wavelengths and the power intensities from the devices, you got to kind of trust the manufacturers that what they say is what this is. So, I know a couple of the owners of a couple of these companies, and some of them are extremely active on social media. So if you shoot them a message, they respond back. So I feel pretty confident recommending them. So I mean, this panel I got by me is by EMR Tech, EMR-TK. Gimba Red also makes some very good panels. He has some
Yeah,
very great data on the dosing. That's actually the hardest part is figuring out exactly what the correct dose is because every organ system requires a different amount of time, different intensity of light, distance from light. So that's all stuff I'm teaching myself right now, so I can teach the patients because that's their biggest concern with it.
yeah,
So those are kind of the two kind of bigger panels. For the medical grade stuff, Weber Laser makes the helmet. They make this wristwatch, and then they make that IV laser, and then Thor laser is what I did some of the training with. That's not something that the home user is going to have, but the Olympic athletes in 2016 all were like laying in this thing looks like a tanning bed, the Nova
yeah,
Thor bed that really charges up all the mitochondria all at once. So those are kind of the high level companies that I kind of looking at right now.
yeah. Thank you. That's awesome. I'll put all those in the show notes, by the way. Um, Last but not least, I think you already mentioned it, but let's mention it again. Where can people find you, Dr. Twyman?
Well, I just want to thank you first for having me on the show. It's been an excellent conversation. I always enjoy talking to a fellow biohacker. And places that I can be found, mostly it's Instagram. It's Dr. Twyman, DrTwyman. Same handles on like, LinkedIn and Facebook, but mostly it's on Instagram because I put kind of the biohacking stuff in my stories most days. And then my main website is drtwyman.com.
Awesome. Thanks so much for being on the show.
Thank you for having me.